So coming to the postural changes. So postural changes. So if you see the normal posture, so if you put any plumb line, if you draw a line, it should be crossed from the center of the ear. So that means the ear lobule, and also should be crossed from the shoulders and hips, and it comes to the ankle. So this is the normal posture. But in case of the pregnancy, so because of the growth of the fetus, our structures, especially the curvature of the spine, so this is the kyphotic curvature and lordotic curvatures are going to be altered. So especially this lumbar curvature, lumbar lordosis, cervical lordosis is going to be increased because of the postural changes. So because of the changes in the posture, so these muscles, especially these abdominal muscles and also the back muscles are going to like a changes in the structure. So especially these abdominal muscles are going to be lengthened. This back extensor muscles are going to be the shortened. So because of the changes in the size of the muscles, so it may alter the posture. It may produce the back pain, as well as it may produce in the mid back pain because of the shoulder abnormality or because of the shoulder blade protractions. So the shoulder girdle and upper backs also become rounded. So because of the changes in the breast size and also the heaviness of the breast, so it may pull the breast size forward. So this this muscles becomes tight. So because of the pulling of this pectoralis major muscle and minor muscles, so the shoulders are going to become rounded. So these shoulder blade muscles are going to be weak. These chest muscles are going to become tight. So because of the tightness of the chest muscles, so it pulls the shoulder forward. So the shoulders have become rounded shoulders. So because of the roundness, so they may chance to get like a discomfort or may chance to get pain in between the shoulder blades. So it may produce the mid-scapular pain. So these all because of the changes in the posture. So if you see the changes, especially just now we discussed, you can see because of the heaviness of the fetus and because of the heaviness of the breast, the total posture is going to be altered. So because of the weight, so this pulling the tightness muscles, that is pectoralis muscles, and it may lead to the shoulder blade muscles are going to become weakness. So because of the shoulder blade muscles and also weakness and tightness of the pectoralis muscles, so they may chance to get the rounded shoulder. So suboccipital muscles respond is a effort to maintain the appropriate eye level. So suboccipital muscles means nothing but the neck muscles also going to get the tightness. So because of the extension or because of the lordosis posture, so it may change the eyesight. So the way of the pattern of the looking patterns. So and also because of this weight of the fetus and also altering the posture, the center of gravity. So the center of gravity is going to shift it posteriorly. So because of the changes in the posterior changes of the center of gravity, so it may lead to get change the posture at the pelvic region. The pelvic is going to be tilted. So it may lead to the tightness of the lumbar extensor muscles, that means low back muscles, and tightness of the hamstring muscles, that is the back of the thigh muscles become tightness. So it may produce like a tilting and abnormal posture. So it may lead to the back pain in the mid lower back pain, as well as they may chance to get the discomfort in the thigh regions. So these are the changes because of the altered posture. So how to avoid these complications? So if we give proper awareness to the mother, so we are going to, if they maintain the posture, the correct posture during the sitting and standing and during walking time, so at least they can prevent these complications. So especially we have to give the awareness about these tight muscles, so they can at least understand where they are getting the tightness and where they're getting the weakness. So according to them, so if we give some like exercises, if they practice, we can prevent these complications. So coming to the balance. So just now we discussed because of the postural abnormality, so the balance also going to be changed. So because of the relaxin hormone, the ligaments are going to get the weakness, as well as because of the tightness of the muscles, and also going to changes in the pelvis. So it may lead to the external rotation of the hip. So because of the pelvic tilt. So because changes in the pelvic rotations, so their physical activities, such as the activities of daily living, the stair climbing and also standing, walking forward, or maybe the forward moving. So these activities are going to be a bit challenging if it is grows in the third month, in the third trimester. So activities requiring the fine balance and rapid changes directions, such as aerobic dancing and bicycle riding, so may become is the inadvisable, especially during the third trimester. So that is the reasons. So they may change to get the balance problem after reaching the 7th month, 8th month, because of the increasing the fetus growth. So this period, we should not encourage any aerobic activities, any vigorous exercise. It may lead to the any falls or in an imbalance. So it may give the further complications. So whatever we give the exercises, aerobic exercises to maintain the mother health as well the feet and baby health. So we can encourage the mild to moderate aerobic exercise during the third month and also after reaching the second trimester. Like we should give some precautionary measures during the first trimesters and also second trimester.